But let's get Rob in a little bit. Talk a little bit about your experience, how you got better, how you got on the right track, that kind of thing.
So I guess um, ultimately it just took a little bit of time. I did have some good experiences with the VA. I didn't go for substance use. I was using in and out in between being connected with the VA and stuff. But I mainly went for suicidal ideation
Okay.
and PTSD.
Okay.
And so it was a pretty good or
Did something happen that you got referred? Like, so I guess, how do they help you become aware of the threat of PTSD? How did you even know that was something you needed to deal with?
So when I got out, I just started struggling with
Okay.
anger and irritability, and started getting in fights, and I did start drinking alcohol a
Okay.
lot, and it started interfering with my life, and so I lost my wife and my son, and so at that point I started um, connecting with the VA
Okay.
case manager through the VA connected me and helped me out.
And so, but it sounds like it was more related to the mental health side of things.
Yes.
So talk a little bit about that because, other folks' experience was maybe more on the substance side of things.
Yes.
What kind of help did you get for that? How did they treat it? Did they send you somewhere? How do they handle that whenever you go?
It was so I went to Colombia and I spent 2 weeks over there,
Inpatient?
inpatient,
Okay.
and that one I felt like wasn't that effective.
Okay.
It was 2 weeks, and then I got out, and then
What, did they just do like EMDR therapy or
it
something?
was just talk therapy,
Just talk
group
therapy?
therapy,
Okay.
and stuff like that. And then I went to Salisbury with the SIPU unit, PTSD unit.
So it's a specific PTSD unit?
Yes.
What does SIPU stand for?
I can't even remember.
Do you know?
Holy shit.
I don't ever know these. I
Yeah.
won't know any of those, just so you know, like, as we go.
Typically, every VA has a different set program. Like Asheville, for instance, has a program called SARP,
SARP,
and it's
okay.
like their substance use treatment rehabilitation program.
Okay.
And but everything is identifiable to what the veteran's looking for. Some are very trauma focused. So I know for Rob, being an infantryman and like myself, a lot of vets are exposed to heavy combat,
Right.
and you get home and you're dealing with a transition already. You're trying to reintegrate back to society. You're dealing with family members that you've been away from. You don't know how to deal with that,
Yeah.
and you turn to things for self-medicating reasons like
Yeah.
substance
Is
use.
that kind of like your experience?
Definitely.
Yeah.
And when I got out of those the PTSD unit in Salisbury, I was still struggling a lot, and I just got frustrated, and I turned to substance use.
Okay.
And
But substance use more sounds like to kind of self-medicate than anything,
oh yes,
Yeah.
definitely to
just to deal.
run away from the anxiety, depression, or just to deal with it, like you said,
Yeah.
Rich.
Yeah. How do you feel it's finally started to get better? Obviously at some point in time you start to turn the corner a little bit. Can
Oh
you
yeah.
can you point to any certain thing or any certain moment?
I think it's when people just started showing me grace and compassion, and helped me along, met me where I was. Um, and it wasn't judgmental, it wasn't directive, and it wasn't a lot of clinical help.
More holistic in
It
nature.
was the holistic healing,
And
and
it was let me camp out there for a minute because it's so interesting you say that. When people showed you compassion, when people met you where you were, it isn't like you're saying when people finally gave me the answers, right?
right,
Or when the smartest person in the room came in and talked to you and told you when they gave you compassion and met you where you were.
yes, sir.
And that was important to you. It's so
It
interesting that
was.
stands out.
It was really important for me, and I learned that I had the answers. I just didn't know that I had the answers at the time.
Yeah.
And those people that were walking, that were guiding me, that were my peer support, were gave me that time and guidance to help me find those answers
Right.
along the way.
I think that's so important because one of the messages we could try to send is even if you're not ready to go get formal help, even if you're not ready to maybe go check into an inpatient facility, talking to somebody, especially if you can find the right person to talk to, another peer, another vet, there's something about that experience that's helpful in and of itself.
Definitely. Yes, sir.